Okay, good afternoon, everyone. I'm going to call this Outstanding Committee on Health and Welfare Committee meeting to order. At this point, can I recognize Rep. BJ Atto for the motion to adopt today's agenda? Again, there's a motion that's been seconded. Any discussion? Okay, all those in favor of the motion say aye. Those opposed, nay. Ayes have it. Motion carries. At this time, I welcome everyone to the House chamber and to the viewing public. Thank you for taking time off to grace us in this meeting and to network and share valuable feedback that is needed for any item of the agenda. We're going to move on to item C, public comments. I ask that you limit your comments to 3 minutes. If you need more time, you may request for additional time. And before you deliver your remarks, please state your name and the entity you represent for the record. All right. So this time we're open for public comments.
Hello, honorable members of the House. I am Dr. Lily Muldoon. These legislative measures aim to establish a comprehensive CNMI drug overdose policy, a critical initiative and collective endeavor to combat the ever-growing opiate epidemic. The staggering reality of drug overdose deaths reached an unprecedented high in 2022. Did you know that over 100,000 individuals died from drug overdoses in the U.S. mainland in that year alone? And the CNMI is not immune. Just like COVID, we are expected to see an increase in opiate overdoses, just as it has been happening in the mainland and in Guam. So, consider this a preemptive warning, urging us to act decisively and proactively. Having served as an emergency room doctor on the U.S. mainland before relocating to the CNMI, I witnessed firsthand the devastating impact that opiate overdoses have on patients and their families. The urgency of this issue cannot be overstated, demanding a swift, strategic, and unified response. The proposed bill takes a substantial stride in authorizing and mandating first responders to carry the opioid overdose reversal medication that is called naloxone, which is an indispensable tool for saving lives in the critical minutes following an overdose. Naloxone is easily administered. It's a simple spray up the nose, and it will reverse the effects of opiates. Time is of the essence, and sometimes when given in the emergency department, it's too late. So therefore, authorizing pharmacies to dispense naloxone to first responders and empowering individuals, including Good Samaritans, to be equipped with naloxone can bridge the critical time gap and save lives. And I would like to dispel any worry that people may have about naloxone. If it's given to somebody who is healthy, the drug has no effect. But if it's given to somebody who has overdosed on opiates and somebody who is unresponsive or not breathing, it can save their life. And this is important to give to people who aren't just overdosing on opiates that we hear about, like fentanyl and heroin, that are narcotics that are bought on the streets. But it can also be important for patients who may accidentally overdose on their home opiate prescription, such as oxycodone, Norco, or Vicodin. So it can help people across the spectrum. The establishment of a comprehensive drug overdose policy is not just a moral imperative. To me, this is a public health necessity. It symbolizes our commitment to safeguarding the well-being of our residents and cultivating a community that prioritizes the health and safety of all of its members. So in conclusion, I implore each esteemed member of this House to lend your support to these two bills. By doing so, we demonstrate our dedication to confronting the opiate crisis head-on, providing our first responders with the necessary tools, and creating a safer, more resilient Northern Mariana Islands for generations to come. Thank you for your time and consideration.
Thank you. The floor is still open for comments.
Hafide Zantiro, Chair Omar, and members of the committee. I'm Eleanor Cabrera, and as the Director of Development at the Executive Office of CHCC, I represent CHCC in expressing our strong support for HB 2323 and 2325, and thank you for this opportunity. 3 years ago, I was privileged to be part of a team at CHCC to establish CNMI-wide prevention and surveillance measures of opioid and other substances misuse, abuse, and overdose. Essential public education campaigns were initiated to raise awareness about the dangers of opioids, risk of overdose, and the availability of naloxone. Systems were put in place to track and monitor encounters in emergency rooms and health centers across the CNMI involving opioid and other drug misuse and overdose, as well as the administration of naloxone to reverse symptoms of opioid overdose. Since 2020, there have been a total of 123 encounters of confirmed and suspected opioid misuse and a total of 6 overdoses involving opioids. Out of these encounters, naloxone was administered for 5 overdose cases and 2 misuse cases. While there has not been a surge, and we have fortunately not been in a jurisdiction struck by opioid-only overdose fatalities, these are definite indicators that the CNMI is not unaffected by these concerns and should enable our healthcare system and first responders to be prepared in critical gaps of time to reverse an opioid overdose and save a life. We can all agree that even one single substance opioid overdose fatality in our small community will be too many. House Bills 2323 and 2325 have the potential for profound impact upon prevention and response measures because it addresses 4 significant pillars of systematic preparedness: legal authorization for first responders to carry and administer naloxone, and Good Samaritan amendments to protect individuals, including first responders, to administer naloxone in good faith during an overdose emergency are critical components. Accessibility of naloxone to ensure it is readily available to first responders is also addressed in the bill. Training for first responders is a necessary step that will be made possible by CHCC Pharmacy and DFEM's Medical Director, Dr. Martin Rohringer, and ultimately rapid response to overdoses, so first responders are able to quickly and effectively provide immediate intervention on site without first hoping to beat the clock to the emergency room to save a life. Overall, authorizing the use of naloxone is a critical strategy in the broader effort to keep the CNMI ahead and protected from the opioid epidemic that has claimed too many lives in U.S. states and other territories. It represents a proactive approach to emergency medical care and underscores the importance of coordinated response among our healthcare corporation, law enforcement, and emergency services. Thank you, and Chair, if you allow me a little more time, I'd like to also provide comments on the other bill, HB 2339, to establish a tax credit for monetary donations made to public hospitals and/or clinics. May I? The Commonwealth Healthcare Corporation truly appreciates the introduction of this bill and asks for your support as it creates several benefits to both our public hospital and/or clinics and for the individuals and businesses in our Commonwealth making donations. It is known that our lone public hospital and clinics face budgetary constraints due to our mandated cost reimbursement structure, lack of appropriations, inability to solicit donations as a government entity, challenges with Medicaid reimbursement, and alarming levels of uncompensated care. This avenue of additional financial support will no doubt assist in enhancing our ability to provide, upgrade, and expand quality healthcare services to the community. A healthcare tax credit can incentivize individuals to contribute financially to the public healthcare system that serves to the benefit of the CNMI, regardless of the ability to pay. It encourages community engagement and philanthropy, as individuals and businesses may be more likely to donate if they receive a financial benefit, leading to increased support from residents and the private sector who wish to be part of healthcare solutions. We are hopeful that with your support of HB 2339, that this healthcare tax credit for donations also works to foster a sense of civic responsibility for our people to actively participate in the improvement of their local healthcare infrastructure and improve outcomes for all of us. Last, establishing a mechanism for tax credit for monetary donations serves to help reduce CHCC's need for government funding. We understand that government funding is always subject to fluctuations and its own budgetary constraints. These donations will provide an alternate source of revenue directed to our public hospital and or clinics and ultimately have a positive impact because we all know that well-funded and well-equipped are always better positioned to prevent, diagnose, and treat health issues in any community, including our own. Thank you again for this opportunity to provide comments on this important legislation as well. Sizus Mossies and Gillisaw, thank you.
Thank you, Ms. Eleanor. And also, if you could just provide your written comments, and with Dr. Lily also for the
Do you want me
committee's
to
record.
here?
Yes,
Okay,
we'll have someone
thank
collect it. Thank you. Floor is still open for public comments.
Good afternoon, Hafade and Tiro. My name is Joe Kevin Villagomez. I'm the administrator for the Addiction Services Unit at the Community Guidance Center, Commonwealth Healthcare Corporation. Like my two colleagues that have just spoken, I'm here also to ask for your support for House Bill 2323 and House Bill 2325. It's already been told about why we're needing to have this opioid overdose policy in place. I am quite aware that you are aware that, you know, our number one drug problem in the Commonwealth right now, other than alcohol, is methamphetamine. And we see the destruction that it's causing in the community from family breakup, burglaries and thefts, and all the other criminal events that comes with it. One of the key difference, especially with opioids, especially with a drug like fentanyl, is people can die immediately. And this legislation will allow our frontline people to be able to administer the opioid reverse medication like Narcan. There are other medication, but the other ones are needs a prescription. This can be administered by frontline folks like firefighters, police officers, emergency, anybody in the front line. The beauty of the bill is that it allows for folks from CHCC to train the frontline people on how best this can be done in an orderly fashion should the need arise. And like Dr. Muldoon said, if you gave it to somebody that was not having an opioid crisis, it's not going to do any harm. So that's one of the main reasons. The other thing is that we have already supplied outpatient pharmacy and inpatient pharmacy with Narcans. This is now taking it a little bit further by ensuring that the people in the front line have this medication should the need arise. And we need to educate them and train them what are the signs and symptoms to look out for to consider fentanyl as, or opioid in general, as the culprit. We are lucky, but like Dr. Muldoon also say, we are nothing special about us. It will eventually get here. Drug dealers are getting smarter and smarter. You've heard about the lava lamps with liquid methamphetamine that has been arisen. And my fear is that for everyone that we catch, probably 5 or 6 more go through without us. And I can assure you from the Addiction Services Unit standpoint, we are always behind the 8 ball. We cannot keep up with people that are coming in to get help to address their addiction to methamphetamine, either court ordered, voluntarily, or family members have submitted them. So this is a very important legislation, and I implore you, along with the Good Samaritan too, that when people are out in the community that are able to administer Narcan, they shouldn't be worried whether they're going to get sued if some adverse event happen. That the Good Samaritan law, which already has been in place in most places, really would go a long way in assisting the community to be comfortable enough to administer any life-saving mechanism to help people that are in trouble. With that said, Thank
you. Thank you, Mr. Villagomez. We're still open for public comments.
Hello, my name is Grace Kylebach, and this is my sister Aria. Together, we run Boonie Babies, which is a local nonprofit dog rescue here on the island, which aims to help with the stray dog population. So we are here today in response to Bill 2334, which is to establish and authorize the use of legend drugs and controlled substances for euthanasia for animal control use. Access to use of legend drugs and controlled substances for euthanasia across the CNMI is a crucial step in managing the stray dog population in the most humane way possible. Currently, there is limited access to euthanasia, leading to unnecessary animal suffering. Due to extremely limited natural and human resources, the island's stray and shelter dog population far surpasses its care capacity. Therefore, it is in the animals' and community's best interest to have access to the proper and most humane way to euthanize. Boonie Babies' mission is to end the suffering of Boonie dogs and cats by decreasing the stray population primarily through rescue and spay and neuter efforts. Although euthanizing animals is heartbreaking, it is a necessary part of rescue and gaining control of the population crisis our island faces. Not only does euthanasia end current suffering, as well as prevent the suffering of future animals by inhibiting more from being born, it is a necessary tool in protecting the community. Due to the brutal environment of the CNMI, many dogs are often brought in with severe injuries, diseases, and behavioral issues, therefore making the most humane and safe option euthanasia. Currently, there is no official protocol or drugs used when euthanizing animals, nor the trained personnel to do so. This directly impacts the ability of those working in animal rescue to care for the strays taken in a humane and compassionate way. No animal should face the brutality, terror, and pain many face currently at the mayor's shelter and on the streets of Saipan. Bill 2334 would significantly improve animal welfare and is the first of many steps that need to be taken in order to make our islands a better place for all who call it home.
I'm Aria Kylebach, and I would just like to reiterate that this island does not currently have the infrastructure to support a resident veterinarian to fulfill these duties, nor will Saipan in the near future. In the meantime, this community and its animals cannot be forced to go without access to euthanasia resources because of simply a lack of protocol that can apply to this unique situation. We cannot have a lapse in care while waiting who knows how long for a resident vet to come to Saipan. This community needs and deserves to have this service safely provided by trained personnel. It is in the best interest of the Saipan community as well as the animals that call this island home to pass this bill. Thank you.
Thank you.
Good afternoon, Chair Omar and members of the committee. My name is Lauren Cabrera. I am a nurse practitioner, the founder and director of Saipan Humane Society, and the president of Guam Animals in Need, Guam's only animal shelter. I am here to express my strong support for Bill 2334, which addresses a critical component of animal welfare and animal population management in the CNMI, and I am also asking for your support. This bill would allow for designated animal control agencies and humane societies to hold a DEA license for the procurement and administration of approved controlled substances intended for animal euthanasia. This bill would also require that medication only be handled by certified euthanasia technicians who have undergone specific training regarding the regulations, documentation, safe storage, and proper administration of these critical medications. The practice of designating an animal shelter or humane society to perform euthanasia is not new. With a veterinary shortage nationally, it is a poor use of a veterinarian's skills for them to do tasks such as euthanasia. These should be delegated to a skilled technician. In a place such as the CNMI, where there is no veterinarian practicing at all, this is even more critical. To date, 35 of 55 states and territories, including Guam and the animal shelter where I serve as president, allow animal shelters and humane organizations to hold DEA licenses for these purposes. Why is this important? In 2013, a study revealed approximately 21,000 dogs residing on Saipan. With low access to animal sterilization and veterinary care, there are simply far too many animals and not enough homes. This dog and cat overpopulation results in many unwanted strays that are often subjected to short lives of suffering on the streets. If euthanasia is not accessible when they are brought to the government shelter, the animals languish and die. Additionally, many members of our community have found their own pets suffering at the end of life with no options to alleviate their pain. It is heartbreaking to feel helpless when people's pets are suffering. This proposed bill, allowing the use of approved legend drugs for euthanasia, is a critical need. I have consulted extensively with veterinarians on alternative euthanasia methods with non-controlled medications, and I can affirm that the use of legend-controlled drugs is absolutely essential for efficient, humane euthanasia procedures that are also safe to the people who are providing the euthanasia. This is a tried and tested approach. It is nothing new. It is used in many states and territories across the country. This bill is a critical component of animal welfare and dog and cat population management. Thank you for considering it.
Thank you. We are still open for public comments. Okay, moving on our agenda. Item D, new business. To entertain the bills we have on agenda today, I recognize the vice chair for the motion.
I'm sorry, Chairman. We need to have a discussion first.
So, I'm sorry, members, the gallery is still filled with our champions for the bills that they have. If there's any discussion or questions that you'd like to take at this time. Short recess. Thank you, members. For item D, new business, letter A, House Bill 23-23, to establish a cinema drug overdose policy, to authorize and mandate first responders to possess opioid overdose reversal medication, to authorize standing orders for opioid overdose reversal medication, and to provide limited immunity for dispensing opioid overdose medication and for other purposes. I open the floor for discussion, members. Question.
Thank you, Chairman. Have you received comments for this bill?
Yes, and the comments has been distributed
Okay.
to all the following members as well.
All right, thank you. I yield.
Okay, recognize Rep. Camacho.
Thank you, Mr. Chairman. First of all, I'd like to thank each and every one of you who came out to support particular legislations. We appreciate your time. And with that being said, Mr. Chairman, House Bill 23-23, such a critical bill and a much needed bill. So I move that we adopt a committee report for passage on House Bill 23-23. So move.
There's a motion for the committee report to be adopted. It's been seconded. Any discussion? Ready? All those in favor of the motion say aye.
Aye.
Those nay? The ayes have it. Motion carries for the LA to prepare the report. Thank you. Section item B, House Bill 23-25 to amend certain provisions of the Cinema Good Samaritan Act 7 CMC subsection 2801 and for other purposes. Any discussion? Ready? I recognize you. Vice.
Thank you, Mr. Chairman. At this time, since comments have already been received from the general public, I offer a motion for the LAs to prepare standing committee report as it relates to House Bill 23-25. So move.
Moving along, Section C, House Bill 23-34 to establish and authorize the use of legend drugs and controlled substances for euthanasia by animal control agencies and humane societies. Any discussion? Recognize Rep. Camacho. No further discussion? Okay. I recognize Rep. Camacho for the motion.
Thank you, Mr. Chairman. And I move that we adopt a committee report for passage for House Bill 23-34 in its current form. So move.
Okay, there's a motion. It's been seconded. Any discussion on this motion?
Ready?
Mhm. Okay, those opposed say, those in favor say aye.
Aye.
Opposed, nay. The ayes have it. House Bill 23-34 will move to the LA for the committee report. Now moving on to Section D, House Bill 23-39 to establish a tax credit for monetary donations, contributions made to public hospitals and or clinics. Any discussion on this bill?
Ready.
Thank you. Vice, for the motion, please.
Thank you, Mr. Chairman. At this time, I'd like to offer a motion for House Standing Committee report to be produced as it relates to House Bill number 23-39. So move.
Okay, there's a motion. It's been seconded. Any discussion?
Ready.
All right, thank you. All those in favor say aye. Opposed, nay. The ayes have it. House Bill 23-39 is adopted for a standing committee report. Thank you again, everyone, all the members and stuff. We did receive a package for comments and stuff, and most of these packages were all in favor for the bills, and also from the presence here of the supporters in the gallery and stuff. None actually had opposition to any of the items on the agenda today. Okay, thank you again. And moving along, we're gonna move to item E of our today's agenda, miscellaneous. Ready? None? Oh, yes, Repogo.
Thank you, Chair. I just want to comment on the author of House Bill 23-34 to establish the usage of, the use of legend drugs and controlled substance for euthanasia. I know that this bill also mentioned about Rhoda just using any humane possible, to put down an animal. I know that Rep. Ed Probst introduced in the House a bill to also, supervise or authorize a technician by a licensed veterinarian to be able to use their services in Rhoda. So with that, I supported this bill. Thank you.
Thank you, Rep. Ogle. Anyone else for miscellaneous? Okay. If not, again, I want to thank the members for making time and the members of the public who joined us in the gallery and those viewing at home and stuff. At this time, I recognize the vice chair for the next item.
Thank you, Mr. Chairman. At this time, I'd like to offer a motion to adjourn. So move.
Second, there's a motion. It's been seconded. Any discussion? Ready? Those in favor say aye. Those opposed, nay. The ayes have it. Hereby adjourned our House Standing Committee on Health and Welfare. Thank you again.